Okay, so let's continue with other drugs used for the GI system. We're gonna emphasize now antiemetics or medications for nausea. So let me share my screen, and here we go. So medications for nausea to stop nausea and prevent vomiting, they're called antiemetics. So before we go into that, I just want to emphasize right here the vomiting center, this brown spot right here. And as you can see, the vomiting center is part of the medulla, halfway lower portion of the medulla. So what I'm trying to say with this is if I want to inhibit nausea and vomiting, it doesn't have to do with the stomach. I need to give medications that are able to block the neurotransmitters involved in this process. So antiemetics, they are used to block that sensation of nausea and vomiting, and the receptors involved is serotonin, glucocorticoids, substance P, neurokinin, dopamine, acetylcholine, and histamine. So all this right here are neurotransmitters that can favor nausea and vomiting. So the drugs that we're going to be talking right now, they need to block the neurotransmitter. The good thing is we're already talking about most of them, so we just a quick review. So let's start now with the ones that block serotonin. So this one we call them serotonin receptor antagonists, where the main one is called ondansetron. And as you can see, the other ones, ranitidine, dulasetron, halonosetron. So medications that block serotonin, they have the citron ending. So ondansetron is one of the most common medications used to prevent nausea and vomiting. The most common use for ondansetron is on chemotherapy and anesthesia. When the patient is coming back for anesthesia, that's where ondansetron is used. So the two most common uses is prevent nausea, chemotherapy, and when the patient is coming back from the anesthesia. The adverse effects of blocking serotonin, the main one, it will be prolonged QT interval. That means it's going to produce an arrhythmia of the heart and torsates to point. They'll be the two main ones. Moving forward, regarding glucocorticoids, they don't know exactly how they block this mechanism. They think that by blocking the glucose levels of the neurons, they're unable to respond to the stimulation. But like I mentioned in a previous chapter, glucocorticoids, they end in 1. So we have methylprednisolone and dexamethasone. Regarding adverse effects, we already mentioned them. Has to do with a glucocorticoid effect. So that means glucose levels are going to go up. So if the patient is diabetic, we need to emphasize you need to start rechecking your glucose levels just to make sure that you don't need adjustments regarding your medication. Regarding the mineral effect, they're going to retain water, they're going to retain sodium. So you have to make sure that this patient doesn't have heart failure. If they have heart failure, then we need to let them know what are the signs and symptoms of a heart failure getting worse. Being a weight gain of more than 2 pounds in one day, the main sign that the heart is failing. And we have the immune suppression too. So if this patient has an infection, especially on the central nervous system, like bacterial meningitis, bacterial encephalitis, then it's not advised to provide a glucocorticoid steroid to block the sensation of nausea and vomiting. One of the newest medications for nausea and vomiting is substance P neuroconin 1 antagonist. So here the medication is apripant and is used post operation. So patients coming out of the anesthesia, that's when apripant can be used. Still, ondansetron is the most common one, cheaper. Also, benzodiazepines can be used to prevent nausea and vomiting on those patients, and basically because we didn't mention it, they increase GABA in the brain. So if they increase GABA, the brain is going to go into a depression state. So that means that communication between neurons is not going to be that effective. Regarding benzodiazepines, I already mentioned to you, the N in PAM, LAM. Don't mix it with biterides, don't mix it with alcohol, don't mix it with opioids. Benzodiazepines is the only one that has an antidote in case of overdose, lumacenil. The other group is the dopamine antagonist, so now we're gonna block dopamine. Here we have the phenothiazines, an example, prochlorperazine. So again, they end in azine. Azine. So they block dopamine 2 receptors. So again, we mentioned that regarding dopamine in the brain, there's 5 receptors. This one is, we already talk about them when we're talking about psychosis. It's an atypical dopamine antagonist. They only block 1 receptor out of 5, so that means that it's not that aggressive. Regarding side effects, we can see EPS reactions, and we mentioned that it's less likely for atypicals to show this adverse effect because they only block 1 receptor instead of blocking all 5. So EPS is still a chance, but it's less likely. EPS, remember, it stands for extrapyramidal symptoms. Also, phenothiazines, they have anticholinergic effects. So besides blocking dopamine, they can block acetylcholine. And basically here, the adverse effects will be dry mouth, dry eyes, and so on. You know now by now the whole thing. And hypotension, what we mentioned, this is a very common adverse effects. Depending on the presentation, any medication that has to cross the brain barrier, they're going to have orthostatic hypotension. Okay, also we have the butyrophenones, haloperidol, also another antipsychotic. This one is more aggressive. Haloperidol has a higher risk of having EPS adverse effects. Okay, we'll continue forward. Metoclopramide, Reglan, it was used a lot a few years ago, maybe 10 years ago, it was used a lot. It was one of the best drugs there to control nausea and vomiting. And not only because it blocks dopamine on the trigger zone of the vomiting center, but also it will regulate peristalsis, gastric peristalsis. So if you have ever experienced nausea and vomiting, you can feel your peristalsis, the movement in your GI system, weird, messed up. And Reglan had the property of normalizing peristalsis and blocking dopamine in the trigger zone of the vomiting center. So it was a double whammy against nausea and vomiting. Very good medication. The problem is it was abused on the pediatric patients, and babies with GERD, babies 3 months old, 6 months old, They'll start giving Reglan on a daily basis to prevent GERD. And we mentioned if you block dopamine, acetylcholine is going to go high. And we have EPS symptoms, extrapyramidal symptoms. And a lot of babies, toddlers, they started to show this. And now the use of Reglan, even though it's still on the market, is not that common anymore. And then we have the cannabinoids, medications that come from marijuana. So we have dronabinol, marinol, and nabilone, sesamid. And well, they come from marijuana. And the reason that they use them to prevent nausea and vomiting is because it triggers hunger. So that means that they're gonna stimulate the proper movement, proper peristalsis of the GI system for that patient to feel hungry. And by doing that, I can take away that sensation of vomiting, nausea and vomiting. Also, it depresses the brain. So that means that it's gonna depress the signals going to the vomiting center, and that nausea and vomiting stimulation goes away. Okay, so up to this point, those are all the medications that are used for nausea and vomiting. Okay, I'll see you in the next chapter.